Athletic adaptation of a blood while training composition plasma. The liquid portion carrying nutrition, hormones, and waste products oxygen to muscle and remove carbon dioxide. But defense against infection and supports immune function. This enable blood clotting and healing after injury. Comparing baseline blood values between the common individuals and the
Physio
training
class,
athletes.
Mahita.
Common individual RBC count 5 to 5.5 million. Hemoglobin 15 to 16, 14 to 16. Hematocrit 40 to 40%. Lower plasma value, higher blood viscosity. In training athletes, RBC count 5 to 17. Hematocrit 40 to 48%. 10 to 20 greater plasma value, reduced blood viscosity for improved red blood cells adaptation to training, increasing RBC production, erythropoiesis. Training stimulates the kidney to release, triggers bone marrow to produce oxygen transport capacity, higher hemoglobin concentration. Endurance athletes develop 11 hemoglobin levels, allowing each unit of blood to carry more oxygen to working muscle during exercise. Variations in hematocrit level. Hematocrit, the percentage of blood volume occupies RBCs. With training intensity and plasma volume changes typically range 40 to 50% in training athletes. Plasma volume and expansion and sports anemia. When athletes training consistently, plasma volume can increase by 10 to 20%, while red blood cells production increases more slowly. This creates a hemodilution effect where blood appears thinner, deposit deposit having more total hemoglobin. This phenomenon is called sports anemia. It is not true anemia. It is actually beneficial adaptation. The dilution blood flow more easily through vessels, improving cardiac efficiency and oxygen delivery to working muscles. And hence oxygen carrying capacity. Training adaptation significantly boosts your blood ability to deliver oxygen to working. Increasing total hemoglobin mass. Endurance training can increase the hemoglobin mass by 10 to 15%, providing more oxygen carrying circulation. Improved oxygen transport. Enhance capillary density and blood flow distribution and ensure efficient oxygen delivered to active muscle fibers. Performance correlation. Study to show hemoglobin mass volume of oxygen sedentary individuals. White blood cells can respond acute exercise effects. Intense exercise causes temporarily WBC white with count rising 50 to 100% during the immediately after activity. Chronic training adaptation. Regularly training immune surveillance reduces upper respiration infection risk by up to 30% moderated trained athletes. Immune benefits improve neutrophils function, enhance natural killer cells active, and better pathogenic response over time. Temporarily suppress window, post exercise open window, 30 to 72 hours, where immune function is temporarily reduced, increasing infection platelets and clotting factor adaptation. Athletes training influences blood clotting components in improvement ways. Platelets count influence with exercise intensity, acute bounce temporarily increasing platelet activation and aggregation, while chronic tri- while chronic training normalizes these responses. Coagulation factor also adopted, with the training athletes showing improved fibrinolytic activity that helps prevent excessive clotting. These adaptation effects
ఇంగ్లీష్
include
లోనే అక్క చెప్పేది.
as enhance blood flow and optimize clotting mechanism, support faster tissue repair. Understanding these changes helps to distribute normal training response potential clotting disorders. Erythropoietin and the production and regulation. Erythropoietin is a hormone produced primarily by the kidney that stimulates red blood cell production. In bone marrow, during training, oxygen sensor in the kidney detects reduced oxygen level, hypoxemia, triggers increasing erythropoietin release. These cascade activity bone marrow stem cells to produce more RBC. Training stress amplifies these response. Intense exercise creates temporary tissue hypoxia, promoting adaptive erythropoietin elevation. Over weeks of consistent training, these regulates become more efficient, optimize oxygen carrying capacity. Time course of blood adaptation. Blood adaptation occurs on different time scales. Within hours, within hours to days, plasma volume expand by 10 to 20. Cause in initial hemodilution. Over 2 to 4 weeks, erythropoietin levels rise, stimulating red blood cells production. By 6 to 12 weeks, measurable increasing in total hemoglobin mass. Full RBC mass adaptation requires 3 to 6 months of consistent training. These staggered changes explain why early fitness gains reset optimal oxygen carrying capacity. Endurance versus resistance training. Large endurance training, large plasma volume expanded 10 to 20. Significant RBC mass increases and hence oxygen carrying capacity. Greater hemodilution effect. In resistant training, small plasma volume changes, modest RBC adaptations, different immune cell responses. Focus on acute inflammation markers. Both the training types product beneficial adaptation but through physiological pathways. Athletes training under blood adaptation. Training at a high altitude is powerful, but adaptations through hypoxia. Reduce oxygen availability stimulates the kidney to increase erythropoietin production, which derives greater red blood cell synthesis. Athletes typically see hemoglobin level rise by 1 to 3% after 3 to 4 weeks at altitude. This enhances RBC production, increases total hemoglobin mass, improving oxygen carrying capacity. When returning to sea level for practical example from different sports. In marathon running, high RBC mass, high RBC mass and the significant plasma volume expansion optimize oxygen delivery for a sustained endurance performance over long distance. Cyclist enhanced hemoglobin concentration and total blood volume. Adaptation support the intense aerobic demands of competitive cycling. Swimmers moderate blood adaptation reflects mixed training demands with balance improvement in oxygen transport and recovery capacity. Clinical training adaptation for diseases. Sports anemia is a physiological adaptation, not pathological condition. Athletes may show lower hemoglobin concentration